Welcome back to Practical Pediatrics for Parents. I'm Dr. Catalina. On July 23rd, the World Health Organization declared monkeypox a world health emergency. The last time they issued this warning was in January of 2020 about COVID-19. In this video, I'm going to talk about monkeypox, what it is, how people get it, what are the symptoms, how it can be treated, and what you can do to protect yourself and your family. If you find these videos helpful, please subscribe to this channel, and you can receive alerts when more videos about pediatric health-related topics are posted. Monkeypox is an infection caused by a virus. The virus is in the Orthopoxvirus family. Pox is an Old English term referring to pimples that can become blisters, pustules, and then leave scars on your skin after they're gone. The Orthopoxvirus family includes monkeypox, smallpox, cowpox, and molluscum contagiosum. Chickenpox is in a different family and not related to monkeypox. Monkeypox was first discovered in 1958 when two outbreaks of a pox-like illness broke out in a monkey colony in a research lab in Denmark. Monkeypox is a zoonotic disease, meaning that it is transmitted to humans from animals. The most common animal that transmit this are rodents, not monkeys. The first human outbreak of monkeypox was reported in 1970. Since then, there have been many outbreaks, primarily in Africa, but also in other areas brought there by travelers. In 2003, there was an outbreak of monkeypox in the United States, linked to contact with infected prairie dogs that had been housed with rats brought from Ghana. In the 2003 outbreak, there were over 70 cases of monkeypox in the United States. In the current monkeypox outbreak, there have been cases reported in 89 countries, with over 10,000 cases reported in the United States alone. Monkeypox can spread to anyone, most commonly through close personal contact, including direct contact with the skin of someone who has a monkeypox rash, or contact with body fluids such as blood, saliva, or respiratory secretions. You can also contract monkeypox from touching clothing, bedding, and towels that were used by a person with monkeypox. Pregnant women can also pass monkeypox along to their fetus. People infected with monkeypox will take between 5 and 21 days from exposure to develop symptoms. The symptoms usually start with a rash that progresses through 4 stages. Initially, you get a macule, or a flat red spot, followed by a papule, or a raised red bump, that then can become a vesicle, or a fluid-filled blister, and those go on to become pustules, or a pus-filled blister. The rash can be very painful and can take between 2 and 4 weeks to crust over and resolve. Other than the rash, other potential monkeypox symptoms include fever, headache, muscle aches, swollen lymph nodes, chills, fatigue, and respiratory symptoms such as sore throat, cough, or runny nose. Most people who have monkeypox will have mild disease and recover without medical intervention. The treatment is primarily supportive: rest, pain management, and adequate hydration. People with severe disease, or those at risk for severe disease, such as people who are immune compromised, children under 8, or people with severe skin conditions, may be eligible for treatment with an antiviral medication, such as tecovirimat or cidofovir. If your healthcare provider suspects monkeypox, they will likely take a swab from a monkeypox lesion on your skin. They will then send this to a lab for PCR testing. This is currently the only FDA-approved test for monkeypox diagnosis. There is no data to support the use of blood or saliva for testing for monkeypox. Monkeypox illness typically lasts between 2 and 4 weeks. The severity of the illness depends on the underlying health condition of the individual, the route of exposure, and the strain of the virus that they were infected with. West African monkeypox tends to be less severe and less contagious, whereas Central African monkeypox tends to be more severe and more contagious. An infected person can pass monkeypox on to others from the beginning of their symptoms until their rash is completely scabbed over and the scabs have fallen off. In order to protect yourself and your family from contracting monkeypox, you should avoid close personal contact with individuals who may have the disease. You should avoid contact with objects that people with monkeypox have used, including clothing, towels, bedding, and eating utensils. You should wash your hands often with soap and water, or use an alcohol-based hand sanitizer, especially before eating or touching your face. There are currently 2 vaccines that may be used for the prevention of monkeypox. In 2019, the FDA approved the vaccine Genus for use in individuals 18 and older. Genus is a 2-dose series administered 4 weeks apart. You are considered immune 2 weeks after you receive the second dose. A second vaccine, called ACAM2000, has been licensed for the use against smallpox. However, it is thought that this vaccine will provide adequate protection against monkeypox as well. ACAM2000 is a one-dose vaccine, and you are immune 4 weeks after you receive the vaccine. At this point, monkeypox vaccination is not available for the general public. The CDC is recommending vaccination against monkeypox for people who are at high risk, including people who've had a close contact with someone with monkeypox, healthcare workers, and lab workers. I hope you found this video helpful. This video is intended for informational purposes and should not be construed as medical treatment. If you are concerned that you may have monkeypox or you have other medical concerns, you should contact your primary care provider.